Welcome back, everybody, to Lifelong Fitness. Now today we're going to be talking about how far down should we go on our squats. Okay, we see people go ass to the grass, taking their butt as low as they can, just like that. Other people, they limit, they say 90 degrees. So the truth is, it comes down to the anatomy, the morphology of the hip socket. Okay,
yes, biomechanics.
A lot of stuff. So every single person has a different depth of squat. Okay, we see a huge increase in lower back and labral tears within the hip because people are not squatting properly. So what we're going to do is we're going to talk about some of the factors that allow us to make a proper squat. So the first thing is we're going to go over butt wink. It's the #1 reason we see people dropping too low and they can't keep this neutral 20 to 30 degree curvature in their spine while it's under a load. So as she drops down, she's in that anterior pelvic tilt. Now all of a sudden she goes too far, she rolls that pelvis under into a posterior tilt. That is the butt wink. Now you're loading an improper, horrible on the lower back. Okay, that's so what we want to find is where you go down to where the second you do a butt wink, you're too far down. Okay, so the first factor, it is a shallow hip socket versus a deep. So Lauren probably has a very shallow hip socket, allowing her to drop way, way deeper. For me, I can't drop down as far, no matter how far I go down. The hips will not allow that, okay? So that's one thing, shallow versus a deep hip socket. Now the second one can be an anteverted, like she has hip joint, or a retroverted. So we're not going to get into the details of that, but somebody with an anteverted hip socket, they can keep their feet close together and they can keep their stance close and keep their feet straight together, and they can go down farther. Where somebody like me, I may have to have a little wider stance, and a little bit of outward rotation may feel better on the hips than knees, okay? And I can go lower that way. So know the difference between anteverted and retroverted hips, okay? Now, the other one is tightness. Everybody thinks it's a tight hamstring, and I'm gonna argue that. Most of the time it becomes a hip complex. The glute complex, as well as the adductors and calves, way more than the hamstrings. And the reason is because Lombard's paradox says that when you drop down to 90 degrees, most people should have, the knee allows the hamstring to shorten, so it is exactly the same length as the quadriceps at 90 degrees. So that's why it's usually a different musculature other than the hamstrings, okay? So stretching hamstring doesn't always help with that. Now the last thing we want to talk about is the ratio between a femur, shin, and the torso. If Lauren had a long femur, a short torso, and a short shin, she cannot go down near as far. Because watch this, as she drops down, think about if her femur was another 6 inches. Her butt would be 6 inches farther back, and if she has a short torso, it can't elongate, so she has to lean more forward, causing lower back problems. So know the ratio between the shin, the leg, and the torso. So those are all factors. So yes, every single person on earth has a different level of squats. So learn that, so we're not hurting backs, we're not blowing out labrums, okay?
Right.
So hopefully that helps you guys.
And go do some squats.
Absolutely. Take care, guys. We'll see you.